Dear students, welcome to the class on muscles of anterior abdominal wall. I am Dr. Gaurav Agnihotri from Government Medical College, Amritsar. So, if somebody asks you how many muscles are there in the anterior abdominal wall, the answer is 6 muscles on either side of midline. So, we have got 3 flat muscles from outside to inside: external oblique, internal oblique, and transversus abdominis. And these flat muscles are lying in the anterolateral aspect of the anterior abdominal wall. Near the midline lies the rectus abdominis on either side, and then we have 2 small muscles, the cremastric muscle and the pyramidalis muscle in the anterior abdominal wall. Now, the neurovascular bundle of the anterior abdominal wall lies in between the internal oblique and the transversus abdominis muscles. You should know the nerve supply of these 6 muscles. If you look at this slide, the external oblique and rectus abdominis, they are supplied by the lower 6 thoracic nerves. The internal oblique and transversus abdominis, they are supplied by the lower 6 thoracic nerves and the first lumbar nerve. The nerve supply of the cremastric muscle is the genital branch of genitofemoral nerve, while the nerve supply of the pyramidalis muscle is the subcostal nerve. So now we describe the external oblique muscle. This muscle arises by 8 digitations from the lower 8 ribs, and then note the direction of fiber of these muscles. The muscle fibers are directed downwards, forwards and medially. So I tell my students it is like you are putting your hands in your jacket front pocket. The direction of fibers is downwards, forwards and medially, and the muscle fibers, they slowly diminish, and what is left for the flat muscles is the aponeurosis, which is a sheet of white fibrous tissue, and this aponeurosis of the right and left sides meets in the midline to form a median band called the linea alba. So external oblique muscle, after arising from the lower 8 ribs by digitations, the fibers go downwards, forwards and medially, and this muscle becomes an aponeurosis which is inserted into the xiphoid process, the linea alba, the pubic symphysis and the pubic crest. So this muscle is also inserted into the outer border of the anterior 2/3 of the iliac crest. And between the anterior superior iliac spine and pubic tubercle, the lower border of the aponeurosis is folded upon itself to form the inguinal ligament. Above the pubic crest, the external oblique aponeurosis is deficient. This triangular area is representing the part where the external oblique aponeurosis is deficient, and this opening is called the superficial inguinal ring. So superficial inguinal ring is the obtuse angle triangle, that is the area where the external oblique aponeurosis is deficient over the pubic crest. The posterior margin and the upper border of the external oblique muscle is free. So this is about the external oblique muscle. Deep to the external oblique lies the internal oblique. Now this fiber, the fibers of the internal oblique, they arise from the lateral 2/3 of the inguinal ligament, the intermediate area of the anterior 2/3 of the iliac crest, and the fibers go upwards, forwards and medially at right angle to the fibers of the external oblique muscle. And the muscle is also arising from the thoracolumbar fascia, and it is also arising from the inguinal ligament, anterior 2/3 of the intermediate area of the iliac crest and the thoracolumbar fascia. So 3 sources of origin. The fibers go upwards, forwards and medially at right angles to the fiber of the external oblique muscle. The upper fibers are inserting into the lower 3-4 ribs and their cartilages, and this muscle also forms an aponeurosis which is getting inserted onto the 7th, 8th, 9th costal cartilages, the xiphoid process, the linea alba, the pubic symphysis and the pubic crest. Now about the aponeurosis of the internal oblique muscle, one should know that above the level midway between umbilicus and pubic symphysis, the aponeurosis of internal oblique splits into anterior and posterior lamina. The anterior lamina lies anterior to rectus abdominis, while the posterior lamina lies posterior to rectus abdominis. Below the level of this midpoint between umbilicus and pubic symphysis, the aponeurosis of internal oblique is one only. So this splitting is above the level of the midpoint between umbilicus and pubic symphysis. So splitting into anterior and posterior lamina. So once again I repeat that the aponeurosis of internal oblique splits into anterior and posterior part above the level of this line called the arcuate line, while below this level, that is below the level of the midpoint between umbilicus and pubic symphysis, the internal oblique aponeurosis is single. There is no splitting and it just forms the anterior wall of rectus sheath. While above the level of the arcuate line, the anterior lamina lies anterior to rectus abdominis, forming its anterior wall, while the posterior lamina lies posterior to rectus abdominis, forming its posterior wall. Now this internal oblique muscle is there, and in this portion where the lamina of internal oblique muscle is single, so there is no splitting, here the internal oblique aponeurosis is uniting with the aponeurosis of the transversus abdominis to form the conjoint tendon. So this is about the internal oblique. Now we come to the transversus abdominis. The fibers arise from the lateral 1/3 of the inguinal ligament, the inner lip of the iliac crest, the thoracolumbar fascia, and the inner surface of the lower 6 costal cartilages. The muscle fibers are directed horizontally, as you can see with these lines made here, and the muscle then forms an aponeurosis. And this aponeurosis of the transversus abdominis, it splits into superior and inferior parts. So the superior part is above the level of the arcuate line and it goes behind the rectus abdominis muscle, so that the lower border of the superior part of the aponeurosis of transverse abdominis along with the posterior lamina of internal oblique, they form this concave downwards line called the arcuate line or the linea semicircularis or the fold of Douglas. So this is formed at the level midway between umbilicus and pubic symphysis, as I mentioned before. So the transversus abdominis aponeurosis splits into superior and inferior parts. The superior part, it goes behind the rectus abdominis and its lower border forms the arcuate line along with the lower border of the posterior lamina of internal oblique aponeurosis. While the inferior lamina of transversus abdominis, it forms the anterior wall of the rectus sheath below the arcuate line in this portion. So this transversus abdominis is arising from lateral 1/3 of inguinal ligament, intermediate area of iliac crest, thoracolumbar fascia, inner surface of lower 6 costal cartilages. So this is about the transversus abdominis and its aponeurosis. The aponeurosis is inserting onto the xiphoid process, the linea alba, and it is coming in this region. So now we come to the rectus abdominis muscle, which is the vertical muscle. The aponeurosis of the flat muscles, they form a sheath around the rectus abdominis, which is called the rectus sheath. Now this rectus abdominis is arising from the pubic crest. It has got two heads of origin, medial and lateral, in relation to the pubic crest, and the fibers are going vertically upwards and getting inserted onto the xiphoid process, and the line of attachment is to the 7th, 6th and 5th costal cartilages. Now this rectus abdominis muscle has got tendinous intersections. There are three, one at the level of xiphoid process, one at the level of umbilicus, and one midway between the two. So these tendinous intersections, they are present in anterior half of the muscle only, and they are attached to the rectus sheath, anterior wall of rectus sheath. They represent the segmental origin of the muscle. These green lines represent the segmental origin of the muscle, and these green lines represent the areas where the rectus abdominis is adherent to the anterior wall of rectus sheath. You can make out the direction of fibers. It is vertical here. Now we come to the cremaster muscle. Now this muscle is developed more in males. In the females, it is represented by a few fibers only. Now this muscle is in the form of loops, and the loops arise from the medial aspect of the inguinal ligament, from the internal oblique and transversus abdominis muscles, and the loops are extending onto the conjoint tendon, and below this cremastric muscle is getting inserted after rising from the inguinal ligament, internal oblique and transverse abdominis muscles, conjoint tendon. The loops are inserted into the inferior aspect of the tunica vaginalis. Now this cremastric muscle, what is the role of cremastric muscle? It suspends the testes and can elevate it. Now this is the pyramidalis muscle. It arises from the superior border of the pubic crest. The fibers go upwards and medially, and they get attached to the linea alba. Now what are the actions of the muscles of the anterior abdominal wall? They provide support. They help in expulsive acts. These are the expulsive acts. Expiratory acts. These are the expiratory acts. Movements of the trunk. The lateral flexion is done by the oblique muscles. In case of rotation, if the trunk is rotating towards one side, then the external oblique of the opposite side and the internal oblique of the side where the trunk is rotating to, they act together to cause the rotation of trunk towards that side. Flexion is caused by rectus abdominis, suspension and elevation of testes by the cremastric muscle, while pyramidalis muscle is a tensor of the linea alba. So thank you for your time. You can read the text of today's lecture by visiting www.buzzedesire.com, where you can find my book which is available online. So I thank you once again. Till the next time we meet, it's bye from my side.